All right, another busy week is expected on Capitol Hill. I think from here on out, it's going to be busy. The White House will release its budget on Thursday, and Republicans will be pushing forward with the American health care plan as well. Joining us now on set, House Majority Leader Kevin McCarthy. It's great to have you here close where we can kick this stuff around. It is. Yes. It's good to see you, and you look good. What
Take that as a compliment.
It is. This is what
That's as good as you're going to get from me.
What we're hearing is that the votes aren't in the Senate. That's just to get it in a nutshell. Votes aren't in the Senate. My question is, can you keep the conservatives in the House on board if you mollify some of these senators that actually want even more than the conservatives in the House don't want to even give as much as they're giving now. If you have to give more to get the votes in the Senate, can you keep those guys on board in the House?
Look, I think we're in a very good place right now because you've got some from both extremes of the party complaining, so that must mean you're in a very good place.
Is it just bargaining right now? Are they just blowing off steam and just trying to get their...
Every member goes there because they want to legislate, and every member wants to have input in the bill. And we've been working on this for 6 years. Everybody's been giving input. As long as the bill is still moving, people want to make changes to it. I think once we get up through the House, the Senate will look at it. I think this bill is going. This is the bill that the President Trump supports. Mm-hmm. This is fundamental change that we're looking at. I know the CBO score is going to come out today, but remember what the CBO score is going to do. This is 3 phases of changes that we're going to make. This is phase 1. And they're only looking at phase 1. They don't take anything into account, which Tom Price, the 1,400 different elements of power he has in it, they don't take anything into account of what phase 3 is going through. But we all know why we are here. Obamacare has collapsed. Obamacare is failing. 1/3 of the entire country of all the counties only have one provider. 16 counties in Tennessee have no provider coming next year. You watch the premiums continue to rise. You saw the 23 co-ops that were given more than $2 billion. Right. 18 of those have collapsed.
Leader, you saw what Tom Cotton said, though. He said, don't walk the plank when it's, you're going to vote on this and then it's not going to go in the Senate. Yeah, hold on. So, I mean, there are problems right now with trying to wrangle all these cats.
I think there's a bigger problem if we do nothing and allow people to continue to suffer.
I agree, but there are some guys that would just like to totally repeal it. It is the genie out of the bottle. There is a new entitlement, so it's going to stay.
No, no. How is that a new entitlement? We are repealing. We're repealing all the taxes, individual mandates on business, medical device tax. This is the bill we sent to the president's desk.
Tax credits that are like they used to be subsidies. Now we call them tax credits. I agree with you. That evens out the corporate, the personal with the corporate.
If businesses get to write off, if the individual does not, that levels the playing field. If you're allowing somebody to keep more of their own money and make their own decision in where they go with health care, to me, that's conservative. I don't understand how that's an entitlement.
Look, last November, the American people did something nobody would have bet would have happened. What's wrong with the Democrats today? They still can't believe it happened. But the Republicans have to understand it happened too. And I'm not going to sit and argue this piece is good and that piece is bad. But if you don't get your guys in a room and say, guys, this is our moment, the American people will throw you out, too, the next time. They're fed up. They did a very dramatic, earth-shattering thing. They elected, and who, by the way, I think has the capacity to go down as one of our greatest presidents ever. Why? Because if he does things people say can't get done. Now, I'm going to say something, not to threaten you, but to point out a moment in history.
Yes.
One of his campaign promises was term limits. Mm-hmm. I know what I'd do if I were him, and I didn't get cooperation from the House and the Senate. I'd say, okay, boys, we're going to our nuclear option. I'm going out and I'm saying one of the reasons nothing's getting done is because these guys are all worried about getting reelected the next time. And you know and I know, election night, when you've been told you're the winner, the first thought you have is, what do I have to do to have it happen in 2 years again? Like it or not, that's the way life is. I don't worry about my job. You guys have to worry about your job. I'm telling you, this is for the Republican Party, not the Democratic Party. Get it done. Because if you don't, the American people will speak again. We didn't have one single vote for Obamacare. And I think that's good. Because we said back then, it's bad, and we shouldn't do it. So our fingerprints aren't on it. Nothing's perfect, and you're not going to get everything you want in that bill. But you get all these guys on both ends of the room and say, guys, Here's your choice.
You want to take him with you?
No, I don't want to go there.
should.
You know what? These are the exact discussions we're
I'm
having
not going there.
inside the room.
No, you just go and just get a little seminar.
Look, I was just at talking to the president in the last week. Many times we're continuing to talk. This is too important. And this is also a part of going into tax reform. Why you start with health care is you could repeal all those taxes, which we are doing. That lowers the baseline by $1 trillion, lets you expand growth even further. If we finish up, we've gone reg reform, health care reform,
right,
tax reform, infrastructure. This country will see growth like they haven't seen in quite some time.
You give
won't
us,
worry about them.
Give us 3.5% GDP growth. All of America's problems, for the most part, financially and economically, go away.
Right.
We can't solve our problems without growth. Growth is the underlying factor we need. Yes.
Leader, on health care, I want to ask you about this. The AARP says the following. This bill would weaken Medicare's fiscal sustainability, dramatically increase health care costs for Americans aged 50 to 64, and put at risk the health care of millions of children and adults with disabilities and poor seniors who depend on Medicaid programs for long-term services and supports and other benefits. The other analysis suggests that actually it will cost people about $1,542 more a year.
So read that very first line again. It says it's going to weaken Medicare, right? This bill does nothing to Medicare. But remember what Obamacare did. Cut that $500 million from Medicare. So these scare tactics will not work. How does it work if you've got more choices? We've watched what's happened with Obamacare, the collapse of why we're here. Humana pulls out. Aetna says it's on a death spiral. So everybody agrees something has to be done. This audience probably knows better than anything else. When you bring more competition into the market, what happens? People get greater choice.
You're right.
And the price goes down. So I rather rely on history and the idea of economics of what works, and we know it will be better. We're giving people a greater choice when it comes to health care. We do nothing with Medicare. If you get your health care from your company, nothing to you. Remember, Obamacare only did 3 major things. 1, it took greater control and put regulations and restraints from government. It created exchanges, which now have collapsed. Only 1/3 of this country has one choice. And it expanded Medicaid. Well, what it did on Medicaid is now going to cost us, within a 10-year window, $1 trillion in 1 year. Put that into perspective. We spend $1 trillion on all discretionary spending for government. So that's unsustainable. We cannot deny the fact that this has failed, and we put a new plan out. This is phase 1 of 3 phases, so you're going to hear a lot of scare tactics. You're going to hear a lot of things that do not take into effect of the entire bill and the outcome that's going to happen.
Putting politics aside, we had a healthcare analyst from J.P. Morgan on earlier this morning, and he said that if you look at healthcare stocks, he broke it down, the hospital stocks in particular, yes, he thinks will be hit pretty hard if this bill goes through. He's giving it a 50-50 shot of getting passed, which is better odds than the broader market is doing. He says the hospital stocks will be hurt because you will have potentially 15 million people that won't have health care insurance who will still be showing up at the hospitals, and the hospitals will have to pay to help them get healthy.
No. Access is not care.
Right.
How many doctors take Medicaid, and how many specialists take Medicaid?
No, his point is simply people show up at the
on?
emergency rooms in the hospital.
Why are they going to show up in the emergency room when now they're going to have more choice? Instead of when now we have 1/3 of the counties that only have one option, you're going to have greater choice. You're going to be going across state lines, and you're going to get to determine where you go.
But Leader,
and
why?
this is age-based too. This is where I have an argument with the AARP. The tax credit goes up with age.
Right.
So we're taking care of that.
So,
and you're
why do you
getting
think
choice
that,
inside.
okay, but then in fairness, why do you think the AARP is not supportive of this? You would think that they would be trying to support their members, trying to support people
Their
in this
members
age
are
group
more so on
who
Medicare.
want to have health care, and they think for some reason that they're going to be worse off, not better.
They don't have any. There's no way they'll ever go for any type of entitlement reform for Medicare or Social Security, Andrew. They're looking at, you're never going to talk the AARP in any of this tough choices.
You can
that we have
also
to
look
make.
at the Kaiser study that will take a 50-year-old person that lives in my district in Kern County, says it's going to be better off with this plan. So I can give you plan to plan, but we all know
we need a means test eventually. With some
we
of
all
this
know the
stuff, right?
simple.
You know where I'm on that. I'm not
you don't
against
agree
means
with the
testing.
AARP.
I'm just
You guys-
I'm asking the question, given that we're talking about this issue.
Well, you know what?
You're confusing your viewer. Becky, medicine is moving to more ambulatory care. The most dangerous place in the world to be if you're sick is in a hospital.
Right,
because of infection.
And you see people going to other places, but the problem is without the individual mandate, you will have people, younger people in particular, who probably will just not go for the health care coverage.
No, but you're talking
it's expensive. And
Becky, you're talking about the hospital stocks. What I'm saying to you, like the retailer should worry about getting more sales and not this border adjustment tax. The same is true with the hospitals. They got a bigger problem, Becky. More and more, we do a HIP at NYU now, we'll get you out the next morning, overnight.
But I'm talking about the people who show up without insurance and who have an urgent care matter. They've been in an accident, something's happened.
Guess what,
it's
Becky?
The hospital. I mean, you know this for well,
Becky,
being in a hospital.
Well, let me tell you what. Let me dispel the notion. Not one single hospital in this city has ever turned anybody away.
Exactly.
Come on. You go to a hospital, a kid's bleeding to death with a car accident. You don't say, give me your insurance card or I can't touch you. Come on. Of course you do.
You take care of them, but their point is the hospitals are going to be left with bad debts piling up. That's what the analyst said this morning, because of the people who aren't covered who show up in an urgency.
Becky, I think that's a scare tactic more than anything else.
It was a healthcare analyst who
I know, I
told people where to put their money.
understand. Look, this has got to be fixed. It can't go on the way it is. That's the important thing. It's got to be fixed. And you guys are living with a perishable commodity, your terms. Okay, it's that simple.
Look, I see what everybody says on the outside, but look at where we're going. And the difficulty is we have to do this in what is called reconciliation. So we can't write all three phases into one. That's why you're going to get study after study that says it doesn't follow all the way through, because they can't take into effect the power of Tom Price as secretary, which in the ACA gives him 1,400 different points of shall. Can't take into effect those things that we're going to do in the third phase, selling across state lines and others. So from that point, if you look at it overall, this is going to be lowering the price. We're not shooting for status quo. We're shooting for something much better and giving people greater choice in their own health care decisions. Think about what it's done to business, the mandate, 30 hours. 50 employees or greater. It's put a whole generation having to work 2 part-time jobs.
Bingo.
And no one's scoring that in the AARP,
Leader,
are
is
they?
there a way to, and here's the issue, though, in terms of the scoring and the way the American public thinks about this, is there a way to include phase 2 and 3 politically today?
Yeah, we talk about it today. We will move some of the bills that will take 60 votes, which are on phase 3. Some of those will start moving at the same time we move this on the floor in the weeks after. So you'll start to see those, and you should take that into effect. But phase 1 also has, as former Senator Colburn were talking, the Byrd rule, which is difficult. So we're dealing with these rules in the Senate, which is ironic to me, those in the Senate who want to tell us to slow down on others. It's because of their rules we can't do all 3.
Can I ask you a question about the rules?
Yes.
Can a simple majority change the rules?
In the Senate?
Yeah.
They have the power, yes, they can.
Why don't they do it?
Some will take...
Harry Reid did it with federal judgeships. Why don't we do it? This is an example of a lack of courage. What are you going to do if this nominee for the Supreme Court doesn't get confirmed?
He's going to get confirmed.
I agree he's going to get confirmed. But the next one is going to be the big fight. The next nominee to the Supreme Court, that's going to be the big fight. Hey, guess what? Change the rules. Have some courage. You can do it. You got the power.
Well, I don't have the power. I'm not a senator.
No, I'm saying you, the Republicans in the Senate right now.
You're looking more senator-like.
He does look good. He looks like a good senator.
I think the Senate is like a country club and the House is having breakfast at a truck stop. We are a microcosm of society. I feel very privileged to be able to serve.
They just meet and talk in the Senate. They just meet and talk. They do. We've seen that for years. John Kerry, perfect senator. You got 20 guys you can play with in the House. Some of them are probably not going to go. You got like 2 in the Senate. Does that mean, right? I mean, does that mean that you've got to move towards the Senate and give them some of the stuff that they're whining about? Or
I always look like this. The way our country was created, you have 2 bodies. Do the work in the body that you are and make a very great product and let it send over and have them do whatever work they think they can do.
I think that's laudable.
And don't underestimate, we've gone through 2 committees already. Yeah. And every Republican voted for it. And in both committees, they're a microcosm of our conference, from the Freedom Caucus to the study group to Tuesday group. That means every spectrum, from the most conservative to those that will be on the other side. And they all voted for it. Now, it's a good place to be when you have both extremes of the country concerned about a bill. You might have hit just the right place. And remember, the president's going to go on the road talking about this bill. And I think when he engages the American public, it'll be different.
Will President Trump put pressure on any senators who aren't going to vote on it? Do you expect him to really go to bat?
Well, let's make sure, let's move it out of the House and then move the next. Look, every part of us building and making this country better starts with health care.
Right.
And if we falter here, they're harming the entire agenda going forward. And that should not be the case.
Your opponent's worst nightmare is that you guys get something done.
Yes.
That's their worst nightmare. They would love to tie it up just the way it is right now and say, see, they didn't do anything either.
Yeah.
Get it done.
Are you a border adjustment tax guy?
I'm for overall tax reform. To me, the element of all the last election is the lack of growth in this country.
Right. So are you a border adjustment tax guy?
I support border adjustment.
Good for you.
Big one. So it's you think that can get done too? It's the same problem that I see, though. It's like I see these guys that are against it. They look like they're going to.
This is the legislative process.
Really?
Yeah. If I want to have influence on a bill, at the very end, I'm going to complain and I'm going to try to negotiate something, and that's human nature. That's what legislators try to do. And you're watching the process, what we're going through, and the same time they're saying this, it's moving through committee, and it's moved through 2 committees already. Now it's going to budget. Then it'll go to rules the next week, and then it'll come to the floor. And you're going to continue to hear this as it goes.
Because the Democrats have an excuse for the last 8 years, or the last 6 years anyway. They have an excuse because they couldn't get anything. You've got all 3. You've got the presidency in both houses. You've got no excuses.
This is only the 3rd time since World War II has the public ever entrusted us with this power. And we are not going to waste this. And we know this is precious, and we're going to represent it. Now, Democrats had where they had supermajorities in the Senate. They gave us the Great Society, and they gave us Obamacare. We don't have 60 in the Senate, so we have different rules that we have to apply.
You have one of the greatest opportunities in the world.
I agree.
And that's Donald Trump. Why? Because I think this guy is willing to make bold moves. He proved it in the campaign. And he won.
Well, I see it just like in business, we have disruptors.
Yeah.
Donald Trump
He's
is a disruptor.
You're right.
That's what we need to shake government up.
Absolutely.
And he will push us.
And it's a moment in time, don't blow it.
Can I
agree.
Just, I hate to go back. You talked about this Kaiser study, and we got a couple emails while we were on the air.
That's great.
And I've been looking at the study, and I just want to read. This is a summary of it that the New York Times put together. It said that low-income people would face a much larger gap between the value of their tax credits and the retail price of insurance than they do now. Poor older adults would face the largest crunch. The magnitude of their tax credit shrinks, even as a separate provision in the bill allows insurers to charge older people substantially higher prices than they're allowed.
Well, they're arguing the 5-to-1 to 3-to-1. So when we repeal all that in Obamacare, but what that did in Obamacare, it priced out the younger people, and so the younger people didn't join. And right. You know, when you do insurance, what it is, it's a group of individuals, right? So you want the people that are younger, that don't need it as much, because it makes the market better.
Right.
Well, in Obamacare, they did 3-to-1, so it pushed the younger people out. That's part of the reason why the collapse.
Right.
You're also not taking into effect, in my belief in there, what does it do to the marketplace? What does it do to business? What does it do to small businesses? What does it do to moving people out where they have to have 2 part-time jobs? That created a whole new lower economy with having Obamacare. That's all repealed. We're repealing the individual mandate. We're repealing the 3-to-1. But you're going to get greater choice. Our tax credit goes up for those who are older, so you get more because that's what you need. Look,
but just in fairness, this Kaiser study, you cited the Kaiser study before.
Yeah, and I could take the Kaiser study, which you gave me a fact of the AARP, and I could take the exact study where you're repeating to me saying it's harming somebody who's older, and I could take a 50-year-old that's inside my county, and it's better for them. So I can pinpoint any part of any study you want to do. So let's look at principle. If we bring more healthcare into the market, if we allow people to make their own decision and we give them a tax credit in to do it, I believe history has shown greater competition across state lines, more choice, the price will go down.
That may very well be true. I just wanted to point out that it's not clear that Kaiser agrees with you on that.
But Kaiser does agree with a 50-year-old in my district that is better for him.
For your district, but not all.
My district in Kirk County, my district is probably one of the most diverse districts you can find.
Okay.
It's not high income.
Okay. Fair enough.
We shall see. What's
Look,
next?
this is the
one day-
legislative process. The key to this is when we get health care fixed, and remember, we don't want to compare ourselves to Obamacare. We want something better. That has failed. There's a reason why we're at the place we are. And that's, in this whole debate, people forget that. If we did nothing, what would you end up with? Well, Medicaid is not sustainable. It's going to take every dollar, discretionary dollar you ask for, so you wipe out all of government. Secondly, this doesn't do anything with Medicare, it doesn't do anything with your health care that you have in business. So the exchanges. Well, the exchanges are on a spiral. That's not my words, that's the health care. That's not a study, that's what's actually happening today. I'd rather live in reality than what someone sits back and try to study.
No question
Right.
that a lot of this stuff is unraveling, and that we've seen many of the big insurers step back. Some on the other side, they'll push back and say, why get rid of the taxes that go in along with that? Because if you kept the taxes and did all the changes that you're doing, you'd be shoring up some of these other areas.
Why get rid of the taxes? Because what has the medical device tax done to this
I
country?
know. I complained about the medical device
innovation.
tax when they put it in. I complained about that and wrote a
You know what
column.
else is going to happen too? If we're all sitting, you do it every day on this show, talk about growth in this country. And if we want to
That's
solve
the-
any of our problems, we have to get growth up.
Amen.
When you lower the taxes, you change the baseline of this country as we move forward for tax reform. That's why we'll pivot to tax reform next. If we have a pro-growth tax reform that comes out, you bring jobs back to this country, you get growth above 3% to 4%, and why is less than 2% the new norm in America? Why do we settle for mediocrity when we can be great? All these problems will go away. And you know what? When you have disruption and you have change, and you want to turn something around like this big aircraft carrier of this country is, it's not easy. But the future of where we're going is so much better than where we currently
We hire 80,000 people in the spring season part-time. And why are they working? Because they need the money.
Home Depot.
Home Depot. 80,000. We already have 360 to 400,000 full-time. These are associates. These are not contractors or commissioned people. The number of part-timers that would like to work more hours,
Yep.
we can't let them work more hours because of Obamacare and the 30-hour limit. So what happens? To be safe, the store manager says, I'm cutting them off at 28.
Exactly.
If you got a great person in the garden department that knows a lot about flowers, let them work 60 hours. That's when people buy their flowers. Let them get comfortable that this guy knows what he's talking about, and I shouldn't plant it there because it's too much shade, or I should put it over. The point is, this is a bad law. You got to get out and sell it. What you're going to do different. And this is where I think most American people don't know what the hell you're talking about. About whether it's
And there's
this
a lot
or
of scare
that.
tactics out there.
Huh?
It doesn't affect everyone. There's a certain portion of the population
You're right.
that Obamacare did exchanges and Medicaid. And I sat down with 18 governors, Republicans and Democrats, in a room with no press, talking about moving forward. You know what they all asked me for? Flexibility.
Right.
Let us manage our population. Give us flexibility. That's exactly what this bill does. And our states are pilot programs. Some of our best ideas all come out of states and governors that are managing. And we allow them to do what they need. And it's not one size fits all. Let the states go out and show what they can have happen.
I want you to just tell me right from honestly, from your heart, what flank are you more worried about? The flank that wants more, or the flank that wants to actually cut back and wants
More.
less? You're worried about the ones that want more. So you're
Yeah.
worried about the Senate.
Can't have it both ways. You're right.
I always worry about the Senate.
Yeah.
We all do.
Hey, before we go, because I know we're going to talk about it in the next segment, what did you think of Preet Bharara getting either fired or being pushed to resign?
Look, I know that's going to make a lot of press, but just like every administration, why do we have a new cabinet? Every administration goes through this. Let them carry out their people and put it through. And in every administration, those that are on the outside complain about it. But I think it's part of the transition that's going through.
Leader, very quickly before you go, we've heard timetables from members of the cabinet in the past about what they would like to see done. What is your timetable for both the Affordable Care Act, the American Care Act, and tax reform? When do you expect to see these passed?
Well, I want this all done by September, and infrastructure. I want reg reform, which we're not talking a lot about, but is transforming the mindset of where capital is going. Only one time in history have we ever signed into law a Congressional Review Act prior to this administration. We already signed 3, we passed 14. Now we're going to health care. Then we'll go to tax. Then we'll go to infrastructure. I think getting that all done in this first year is probably one of the most productive Congresses, but actually change the country around, and we have to have it done.
All right.
Well done.
Yep.
Well done.
We'll do
We're going
it.
to take.
I take that as a big compliment.
It is from him,
And
yeah.
You want to know this? The gift I used to give my nephews, just a small working guy, I'd buy him 1 share of Home Depot.
There you go.
Great bet.
That's what I gave him for
All I
birthday.
can tell is
Amen.
I'm 82 and Bernie's 87, and we're out completely, and we're still working like hell for the stockholders, okay?
right.
For nothing.
And April is your Christmas.
April's our Christmas.
I know that well. It's a great company.
Thank you very much.
And for your time.
Thank you, Leader.
Thank
It was
you.
a great
Thank
conversation.
you, guys.
Appreciate it.
I
Thank you.
appreciate it.
Thank you so
Thank you.
much.
Look forward to
Great
seeing you
job. We'll see
later.
you back in D.C. or
All right.
hopefully back here on set in the meantime.